I now call upon Madam Rosa Anyango to be able to speak about prevention of mother-to-child HIV transmission.
All protocols observed. Good afternoon. Good afternoon once more. My name is Rose Anyango Jomo. I come from Migori County. I must first of all say thank you, Global Fund, for allowing all PRs to support us as the community. I also want to say thank you to Catholic Medical Mission Board for allowing us, the HIV community, to get information, to transfer all this information to our fellow colleagues. Now back to me. I got diagnosed with HIV way back in the year 2011. I got married back then. I was a young, naive lady who never knew much about life when it comes to HIV. I happened to conceive, that is, as a mother, I had to go for antenatal clinic. I got tested, my hubby, a supportive man, thank you, took me to a very nice private facility. But then, back then, there was the liberty of you telling the doctor, don't say this, don't say that. So I was in the dark. A nurse told me quietly that I feel you should really go to a public facility and you really need to know your HIV status. And luckily, I didn't go for antenatal care at a public facility back then. I visited a clinic for 9 visits, but private facility. At delivery, I went to a public facility. I got tested while having the pain, a first baby. So in my mind, whoever was telling me, do you know your status? This is the result. I told this person, I think you need to keep your story at bay. I'm focusing on something else. And my focus changed when the baby was 6 weeks. That's when the truth hit me. I met a person at the facility who was a champion HIV. She told me, I think you really need to understand yourself, because I didn't know what HIV and the dangers of not starting care and treatment entailed. So I took my time and listened to her. It happened that very day was a support group for PMTCT specifically. That was when the PMTCT program was kickstarting. So I had to sit through the session. I found that I wasn't alone. The journey wasn't for me alone. We had lots of women who faced a lot of challenges back there. In my child's birth cohort back then, a lot of women never knew a lot of information about family planning. So we had, in that cohort alone, we had about 50 women that delivered in that same cohort alone, which means 1 month. Out of 50, 30-something babies were positive. Some turned at 6 weeks, some at 9 months. So I was pained. I started my ARV at 6 weeks post-delivery, but then the journey was not so nice. At the time my child was discharged, most mothers never had their babies. They were dead either, they were so unwell, some were positive, were discharged to care and treatment to start ARVs for life. So I took up a responsibility to myself and said, I need to make a change. I really need to impact a life, because somebody held my hand and then told me, you are not alone, you can do it. So yes, it's possible. I have 3 success stories, which means 3 negative babies. One is turned 5. The other one, the 2 are turning 13 and 8. Now, I have few successes. As a Cmmb expert mother, I work closely with all mothers at the community level. Mine, basically, I am at home. I reach out to these mothers that don't have facility information. Most of these avoid going to the facilities. Once they know they are positive, they seem to avoid facing the doctors because they will feel like everybody is putting pressure for them to start care and treatment. So my work is down there to talk you through it, to see the sense and help yourself, help the child, and help the family. And because of that, you will learn with me that HIV prevalence, new HIV, infant positivity in Migori County is below 5%. I want to believe it is so. It's efforts between us, community personnel, and facility personnel. We don't work alone. Then, at the community, we also do activities that really target income-generating activities for these mothers. You find that back at home, reality per ground, most mothers are dependent fully on their spouses. And when you're fully dependent financially, you tend to be abused. You really tend to be controlled. So we sit up in our support groups and find a way of doing income-generating activities. And we also do table banking through my organization, which is Cmmb. They've tried to invite bankers like the Kenya Women Representatives. They empower women in our sittings. They've also tried to bring on board agriculture and all other stakeholders so that mothers are taught on the benefits of standing for themselves. And you find that most of these women make right decisions for themselves. They don't really need to listen to the money producers who are their spouses. My prayers, I really pray that we continue to fight mother-to-child transmission by also, one, supporting fights against gender-based violence. You find that if I am fully dependent, I tend to be naive and really accept being violated on. I once had an experience of a mother who turned positive. The husband said, you can't seek medication because after all, he is the one that will give fare to the venue, to the facility. He's the one that will produce food. So, ataka nyumbani, and you know health right is a human right. So let us all fight for atrocities against human rights. I also plead that we all stand up together and not only focus on mother-to-child transmission. It doesn't start with the mother alone. The families, the brothers, the sisters, let us all focus on elimination of HIV itself. Thank you, and I say thank you once more for our Global Fund giving us this chance again. And I also say thank you to Red Cross and thank you to Kenya Catholic Medical Mission Board. Thank you.
Thank you, Madam Rose, for that powerful testimony of how you are working in your own space to be able to mentor and inspire other mothers, and the role of partnerships in doing this together.